Baker administration and advocates for everyone's hard work and collaboration in organizing this very important hearing today. Developing Alzheimer's disease is one of our worst fears for ourselves or for a loved one. It's a progressive brain disease with no cure in sight. More than 5 million Americans are currently living with Alzheimer's, including 120,000 of our fellow residents here in Massachusetts. And alarmingly, this number is expected to triple by the year of 2050. Furthermore, most people living with Alzheimer's are not diagnosed or are not aware of their diagnosis, something that I find particularly concerning. Alzheimer's, as we know, takes a devastating toll, not just on those with the disease, but also on their families and their caregivers. Nearly 60% of caregivers rate the emotional stress as high or very high, and about 40% suffer from depression. The growing cost of caring for those with Alzheimer's and other dementias is a huge burden on our healthcare system, particularly Medicare, but also Medicaid. Nearly 1 in 5 Medicare dollars is spent on people with Alzheimer's, caring for people with Alzheimer's and other dementias, and this number is projected to increase to 1 in every $3 by the year 2050. At that point in time, the total cost is projected to exceed $1 trillion, and that's in current dollars, 2015 dollars. Massachusetts policymakers, healthcare providers, advocates, and others have worked together to make the Commonwealth a leader in many areas when it comes to dealing with Alzheimer's. Some very quick examples include our strong home and community-based services, our Silver Alert program, standards for dementia care in nursing homes and assisted living facilities, and efforts to prevent elder abuse and neglect. But we must ask ourselves, what more can we do to improve our state and our community's preparedness for the growing Alzheimer's and dementia public health crisis? And yes, I do believe it is a public health crisis. Today we will have the opportunity to hear from a wide range of experts about all facets of policy related to Alzheimer's, including research, prevention, diagnosis, treatment, home and community-based services, caregiver support, training, workforce development, data collection, and safety. It is my hope, and I know one shared by my colleagues here alongside me, that today's hearing will identify further concrete steps that we should consider, including legislation, and will foster ongoing dialogue and collaboration between lawmakers and all the stakeholders that are working to address this very complex and challenging issue. I want to thank you all in advance for being here and for participating in this hearing today. And now I'd like to hand it over to Representative. Would you like to? Sure.